Hey everyone, and welcome. Today we are clearing up the confusion between Mast Cell Activation Syndrome, aka MCAS, and traditional run-of-the-mill allergies. And this mix-up is one of the biggest reasons why my MCAS patients go undiagnosed for years. I'm going to tell you exactly why this happens and how to avoid it. Hi everyone, and welcome. My name is Dr. Kara Wada. I'm an allergist immunologist, and more importantly, maybe I'm also a fellow patient navigating the unpredictable world of autoimmune diseases. And I've had my own brushes with some inappropriate mast cell issues, which maybe we'll talk about either this week or next. I have seen countless patients over the years who've been told that they just have allergies when they're actually dealing with something that's more complex. They're given antihistamines, they're told to avoid triggers, and they're sent on their merry way, and they keep getting worse. Some have eliminated so many foods from their diets. They're down to, some folks down to like 4 or 5 foods that they consider safe foods. And even then they question how safe they really are. They're still having reactions. And when they go for allergy testing, they're told one of two things. One, that their allergy testing is totally normal and negative, or the other situation can happen that they're positive to everything. We're going to talk about why those two things happen. And the reality is that, these stories are so common and it breaks my heart. That's why I'm so passionate about explaining the difference, because getting the right diagnosis, understanding what's going on in your body, that changes everything. The key difference is that traditional allergies are predictable, they're specific, and MCAS tends to be the exact opposite. It can be unpredictable. Folks can react to lots of different things. And by the end of this video, you'll know exactly how to tell them apart, what to do about it. So let's start by talking about traditional kind of run-of-the-mill allergies, this more predictable response, because understanding these is going to help us see why MCAS is different. It's really helpful to have that comparison. In traditional allergies, your immune system has learned to recognize specific triggers like pollen, dust mites, your pet, peanuts or shellfish, and it's created an allergic type memory. It's called an IgE antibody. You want to think of it as like a bouncer at a club who has a list of troublemakers. And every time one of those troublemakers shows up, the bouncer is going to kick them out of the way in a similar way every time. And here's what makes traditional allergies predictable. One is that they are caused by what is considered an IgE-mediated reaction. This involves specific antibodies or immune system proteins called IgE. When you were first exposed to an allergen, your immune system creates this allergic memory in the form of this IgE antibody. And then on subsequent exposures, these antibodies recognize the allergen and they trigger the release of histamine and other chemicals from mast cells and basophils. These also have pretty predictable timing. Most allergic reactions happen within minutes, typically of exposure. So if you've eaten a shrimp and you react within a couple of minutes, you know that it's more easy to know that that's the trigger, right? There are a few caveats to that. There's another condition called alpha-gal allergy, which may be delayed by a few hours after exposure. We'll tackle that in a future episode. Symptoms are also pretty consistent. Reactions follow a pretty well-defined pattern that we know occurs with IgE-mediated mast cell activation. The specifics between each reaction may look a little bit differently in each person. The severity may differ a little bit in each person, but the types of symptoms you have stay pretty consistent. Itchy, watery eyes, runny nose, sneezing, nasal congestion, itchiness in the throat, coughing, wheezing, chest tightness, rashes that are raised and itchy that look like hives. And in severe cases, can have difficulty with blood pressure. With food reactions, often people will get extremely nauseous and throw up. There also are clear triggers. Most often with allergy, you can pretty quickly identify what caused your reaction because that reaction happened in such close proximity to exposure to the trigger, right? You ate that specific food, you pet a cat, and you are usually around cats, that sort of thing. It's also testable. This is huge. Skin prick testing, those little scratch tests, and blood tests, which are serum IgE tests. Often they're still referred to as RAST tests, R-A-S-T. It's an old term, but it's what kind of gets passed along. We use serum-specific IgE tests now. These are very reliable for traditional allergies, especially allergies that affect our sinuses, our eyes, our breathing. Now, allergy testing for foods is a little bit different in that you really need that lived experience of the symptoms plus the positive test to diagnose a food allergy. Now, I want to be clear, traditional allergies can absolutely be serious. They can be life-threatening, especially in the case of food allergies, latex allergy, but they follow rules, and those rules help us to diagnose them and to treat them more effectively. It's much more clear-cut. Now, let's shift gears to mast cell activation, and really this is like an unpredictable storm. It's a different beast. Instead of a bouncer with a specific list, I want you to imagine a security system that's been hacked and is going off randomly. It is set to a setting that is way too sensitive for what the situation requires. And sometimes it reacts to things that really should be safe. And sometimes it doesn't react to things that previously caused problems. MCAS involves these same allergy cells, these mast cells primarily, but they're behaving more erratically. These mast cells have pre-formed packets of different granules that consist of histamine, tryptase, leukotrienes, prostaglandins, dozens of other inflammatory mediators that in response to triggers are released. And more often than not, these triggers are not IgE-mediated. They are triggered through other receptors on the cell that are resulting in the release of these substances and this really crazy mix of symptoms that people can experience. So what is a non-IgE reaction? IgE, remember, is that antibody that provides our immune system allergic memory. These mast cells can and often are triggered by pathways that are entirely different than those pathways we typically use in traditional allergy tests. That's why often those allergy tests will come back normal, especially if we're doing blood work. Now, the other thing that can happen when we're doing those skin scratch tests is that physical scratch of the skin oftentimes is irritating enough that it can trigger those mast cells to create that red raised bump and the redness around it. It's called a wheal and a flare. And so it's not uncommon to hear many of my patients say, yeah, I went for that scratch testing. My whole back lit up. They said I was allergic to everything. Sometimes what gets missed in that conversation is that the control test or the test where we just scratch the skin with salt water or saline, oftentimes that test is also positive. And that tells us that, gosh, it was the scratch itself that activated those cells to respond, something called dermatographism, writing on the skin when that physical irritation of that cell has activated the release of those chemical substances we talked about and causes the redness, the swelling, the itching, the heat, that inflammation at that spot. Now, MCAS is also really unpredictable. Reactions often will happen immediately, but I also will have patients that say, gosh, these were delayed by hours or even days from what they suspect was the trigger. The symptoms are variable. And this is really a part that can really drive folks batty because, on Monday, tomatoes may cause significant stomach pain and diarrhea. And Wednesday, it may not be as big of a problem. There sometimes is an element of the whole picture of what's going on, what other foods we're eating, what other stressors are going on. For those of us who have menstrual cycles, those hormonal fluctuations can also play a role in how sensitive these cells are to particular stimuli and triggers. Often there are multiple triggers. There are some broad brushstrokes of common triggers that tend to be more of a problem, but every person's set of triggers is unique. Things, though, that I ask patients about: how's your stress level? Do you have trouble with temperature changes, strong smells, perfume section at the mall, chemical exposures like cleaners, exercise, fluctuations in your hormone cycle, especially for women going through perimenopause during that second half of the cycle when progesterone is a little less predictable. That oftentimes is an area that I hear patients say, gosh, it seems like my symptoms just level up that last 2 weeks of my cycle. Infections, huge trigger, emotions, and other hormonal changes related to our thyroid. We also are understanding that metabolism and the gut microbiome are likely playing a role in these symptoms. MCAS is also really hard to test, in part because many of the substances that these allergy cells release are metabolized very quickly, especially at body and room temperature. So often we're using both blood and urine testing. Those specimens need to be chilled immediately after they are obtained, and they need to be sent to specialized labs. I send them up to Mayo Clinic, which has the, kind of known to have the best ability to detect these chemical mediators, especially in the urine. The issue is, though, we don't have complete control over what happens after you void. You may have that specimen on ice right away. You bring it to the lab on ice. Ideally, hopefully, the lab does the same. It gets shipped appropriately. But there always are some concerns that if that specimen isn't cared for properly, that might cause an issue. The unpredictability of MCAS often has patients feeling like they're causing their own reactions, that they feel like they're going crazy, that one day they can handle one food, another day they can't. And I just want to say it's not in your head. It's the nature of the condition. And when your body is giving you signals through your immune system and your nervous system that you are in danger, it is very normal and natural that your brain is going to think you are in danger too. It's often why we hear and see folks in this state of hypervigilance, because their body is giving them the signals that their environment isn't safe, even when it seemingly is. So why do doctors get this wrong? And it's not entirely their fault. Here's why the confusion happens so frequently in medical offices. These conditions look the same, right? They respond to similar medications. Oftentimes, antihistamines will help allergies and they will help MCAS, but sometimes MCAS needs a bit more. The allergy tests are a big issue too, right? The MCAS patients often have completely normal skin tests or the serum IgE tests, also, sometimes called RAS tests. And I often will hear from patients saying, gosh, I've seen 3 different allergists and every other doctor is saying this is allergy, but the allergist says it's not allergy. So what the heck is going on? Because the allergy meds help. There's a huge gap in training. In medical school and residency, and frankly, in allergy fellowship, we spend most of our time talking and learning about IgE-mediated allergies. Mast cell disorders like MCAS are not mentioned really at all until you get into allergy fellowship, which is barely anyone, right? There's not as many of us. And even then, it's not a huge part of the curriculum. Most of my education through my allergy training was really focused on this IgE mechanism. Very little was spent on learning about how complement, how the nervous system, and how other factors like the MERG receptor, which frankly was just discovered while I was in medical school, really all can play a role in the stimulation and the triggering of these cells. And, the big elephant in the room, time constraints. Let's be honest, a traditional allergy situation is much easier to diagnose. You do the tests, you avoid the trigger, you prescribe the medication, you put someone on shots, right? MCAS requires a lot more time, a lot more detective work, and more complex treatment plans. And the system is just not set up for that. So let's summarize by going through some red flags that to me scream MCAS. And this may not be run-of-the-mill allergies. 1, if you are having new reactions to foods that you previously have tolerated your whole life. You've eaten strawberries your whole life, no problem. And now they seem to be a big issue. You're having issues with avocados you never had before. These are foods that are known to have higher amounts of histamine or release histamine from cells that can be irritating. And so sometimes that is a red flag or a clue to me that this may not be run-of-the-mill allergy. You have symptoms, but there aren't clear triggers. You're having allergic type symptoms and you can't figure out what's causing them, especially within that 30 minutes to an hour after exposure. You have symptoms that are across your body, multi-system symptoms. Your allergic reaction affects your skin and your gut and your brain and your heart all at once. You also should be asking and thinking about anaphylaxis in that situation too. Your antihistamine needs are on the rise. You find yourself needing more and more of your Zyrtec or your Allegra or your Pop and Benadryl at bedtime to try to get relief. And it may or may not be cutting it. Environmental triggers. You're reacting to things aside from the typical allergens, temperature changes, strong smells, exercise. These are things that don't typically cause allergic reactions. You have variable reactions to foods. That food was fine yesterday, it's causing problems today. You have normal allergy testing, but everything looks and sounds and acts like allergies. There may be something else going on. We have multiple allergies that just don't make sense. The pattern doesn't fit. These are all things that are going to make me think, gosh, we need to think broader. Could this be something like MCAS? Or if it's related to skin symptoms, is it something like chronic urticaria, chronic hives, angioedema? If you want to learn more, we'll link to a prior episode all about that. If all of your symptoms are related to your gut, are we dealing with something like histamine intolerance, where like lactose intolerance, your body is not doing a great job at digesting some of the components of food we're eating? These are all things you need to think about. And I need to think about as I'm seeing patients with these symptoms. So you're on your diagnostic journey. What do you need to know? First, you want to start with detailed tracking. Keep a comprehensive symptom diary for a couple of weeks. Take a look at foods, timing of your symptoms, your stress levels, sleep quality, any big weather things going on, your menstrual cycle, if that's a thing for you. Look for some patterns. Don't stress about it. That's something that you also can go over with your care team too. The other thing that can be helpful to look at is a baseline serum tryptase level. It's a blood test. It typically is done when you're feeling well. It often will be repeated during an attack or an episode where you're more symptomatic, ideally within 4 hours of those symptoms starting. And there are some people, about 6% of the population, that naturally have higher levels. And that is also another really helpful thing to know. It also helps us evaluate for another related condition called systemic mastocytosis. Has a little different treatment plan. 24-hour urine collection. So we used to do more 24-hour urine collection. Now Mayo Clinic has actually updated their testing where we can do a single void. And often I will have folks do their urine mast cell labs at baseline. And if they're positive, great, we have some answers. If they're negative, we often will repeat these during a flare. How are you doing with treatment? Are you responding? Do you feel better when you take antihistamines? Do you feel better if you add an H2 blocker like famotidine? That response pattern can also be helpful as we think through this bigger picture of your symptoms, how you're doing, and what's going on. We want to rule out other conditions. We want to make sure you don't have mastocytosis. We want to think and look at carcinoid syndrome and other conditions that may mimic MCAS or go along with it. Hypermobility, dysautonomia. We just did 2 awesome sessions on that. Autoimmune disease, immune deficiency. Some of these things can have a significant overlap. Lastly, I want you to know that this can be challenging. And you may hear that, it's just allergies. I don't want you to stop there if that pattern doesn't fit. You know your body best. If something feels wrong, keep advocating to get someone to listen and to really explore this with you in partnership. The other really huge thing is to understand that there's no one-size-fits-all treatment for mast cell disorders. We're going to dive into more of this in a future episode, but it really does take a lot of trial and error. You need to be a scientist in your own care, and that's why keeping a journal and understanding that there are patterns can be really helpful. Whether you have traditional allergies or mast cell activation, you really deserve proper diagnosis and treatment. The key is finding a healthcare professional who will listen to your story, who will believe your lived experience, that will take your symptoms seriously and work with you to figure out what's really going on. I want you to remember something important. You're not crazy. You're not making this stuff up. You're not being too sensitive, and you're not too much. MCAS is a real, complex, not super well understood medical condition that requires a thoughtful and comprehensive approach. If you want to join our Becoming Immune Confident community on Facebook, where we discuss these complicated conditions all day, support each other through the diagnostic journey, I'll put the link in the description below. And if you're in one of my licensed states and you're looking for a healthcare professional and a team who understands these complex conditions, I'd love to work with you. I'd love for you to work with our team at the Immune Confident Institute. We'll have more information on that below. Remember, if that pattern doesn't fit, keep advocating for answers. MCAS is real. It's complex, not well understood, not well taught. The right approach, it is absolutely manageable, and you deserve to feel well. You deserve answers. What questions do you have about MCAS versus allergies? And I should say, it's not always either or. Sometimes it's both. Have you experienced this diagnostic confusion yourself? Share the story in the comments below. Your experience might help someone else on their journey. And if speaking of the future, I have a quick important reminder about my practice, the Immune Confident Institute. As a reminder, starting September 1st, every new patient evaluation will include a complimentary 1 month of our Immune Confident Institute membership access period. This gives you dedicated support right after your visit when we're doing labs, making some pretty quick adjustments to lifestyle and other maybe medications. And so this really helps allow us to increase that level of support so there's no more feeling lost or anxious while waiting for those next steps. To reflect this incredible new value, our pricing will be updated on September 1st. So if you've been on the fence thinking about wanting to start a journey with us, this is a wonderful opportunity to begin at our original rates. Don't wait. The link to learn more and to schedule your visit to make sure you're in a place that I am clinically licensed will be in the description below. Let's get you on that path to feeling more immune confident. And please, please, please don't forget to subscribe and hit the bell for more updates like this. Until next time, in good health, take care.